Hello, everyone. Thank you for joining us today for our webinar entitled Tips and Tricks for Applying Fluoride Varnish. Today's presenters are Rachel Putnam-Farley from the Michigan Caries Prevention Program and Martha McComas and Dr. Margarita Fontana from the University of Michigan School of Dentistry. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping the phone lines on mute during today's presentation. If you have a question, please type it into the questions box in your GoToWebinar interface. We'll take time at the end of the presentation to answer any questions you have. If for some reason we are unable to get to all of the questions, we will email you directly with an answer following the broadcast. With that, I will turn things over to Rachel.
Thanks, Liz. And thank you all for joining us today. I'm excited to be here with Dr. Margarita Fontana and Martha McComas from the University of Michigan School of Dentistry, our partners and dental experts for the Michigan Caries Prevention Program. They're going to share some great information on fluoride varnish and tips and tricks for making the application easier. And we will be available at the end of the presentation to answer any questions that you might have. And with that, I'll turn it over to Dr. Fontana.
Thank you. Good afternoon, everyone, and thank you so much for joining us. Today's presentation is going to focus primarily on a review on tips for fluoride varnish application and answering your questions. But I want to first remind you of something. Although fluoride varnish can certainly be very effective in protecting teeth against cavities, fluoride varnish by itself cannot do everything that we wanted to do to improve the oral health of children in this country and in Michigan. So as you do the wonderful things that you're doing in the medical setting, I want to remind you that this must be accompanied by changes in health behaviors at home. So we would like to remind you, as you saw in your Smiles for Life curriculum during your initial training, to please ask primary caregivers to begin brushing a child's teeth as soon as they erupt with a very small amount of fluoride toothpaste, at least twice a day, and to be attentive to the diet. Sugary things, both in liquid form or in food form, really increase the risk for decay. So it's very important to not have sugary drinks in the bottle or sippy cup during the day, and especially at nighttime, and to limit sugary foods during snack times. With this change, just a combination of what the wonderful work you're doing in your office and the reminders of healthy behaviors at home, together we're going to really be able to make an impact on improving the health of children in Michigan. So thank you very much. Before we begin a review of fluoride recommendations, and Martha McComas is here with me, my colleague and friend, and she will jump in on the slides if there's something else that she would like to remind you about as we move throughout the next few slides. So as a reminder, fluoride can be provided in a variety of modalities. The ones that you are probably most commonly familiar with at home is toothpaste. And then again, I want to remind you that every child should have their teeth brushed twice a day as soon as teeth erupt with a very small amount of fluoride toothpaste under supervision of a parent or caregiver. But the fluoride varnish application that we're going to discuss, that you hopefully have been starting to be engaged in your offices, should be applied as soon as the tooth emerges on a periodicity that can range between 3 to 6 months. And that's for both low and high-risk patients. Right now, the recommendation is as a public health measure to all patients. And we do have a lot of very strong data to support the use of fluoride varnish, which is why the Preventive Services Task Force, the American Academy of Pediatrics, the American Academy of Family Physicians have all very strongly supported the use of fluoride varnishes in medical homes. And we do them also in dental homes. And in general, in dental homes, we will try to change the periodicity, and the higher the risk of the child, we will do it more frequently. So what you are doing, if you appropriately are able to refer the child to a dental professional, we will add to what you are doing. So you are not doing something that is taking place or instead of what we would be doing in a dental setting, but we would be complementing what you are doing if the child is at risk with more frequent application. There's many brands of fluoride varnish out there in the market nowadays. When you got trained, you got samples of a couple of brands. Some are yellow when you apply them. I particularly like this, especially at the beginning, because I can see very clearly where I'm applying it, and I'm sure that I actually got it on the teeth and not the gums or the tongue as a young child is moving their head. But some are clear. Some, when you open them up, you might see that it has separated into two different colors, and that's just because the fluoride and the carrier in the fluoride varnish might have separated. It doesn't mean that the varnish has gone bad. And I want to remind you that if you ever open one of the packages and you see two different colors, please to remember to mix them with the little brush that is normally supplied as part of the varnish, and to just apply the mixed product on the teeth. And it's helpful if you dry the teeth with a gauze. Most of these varnishes are very sticky, as you might have seen. Not all of them are, but the majority are very sticky because they're supposed to stay on contact with the tooth for a long period of time. This next graph is just a reminder. These are the range of fluoride products that we have available in the U.S. market. The ones on the top part of the screen, the mouth rinses and dentifrices, for the most part are over-the-counter, although we have a couple of prescription strength ones. And the ones in the bottom part are professionally applied products. I put a red arrow in the bottom part of the varnish just to tell you that the majority of the varnishes that you are going to be either using because you got samples from or eventually be buying as part of your program are probably going to contain about 22,600 parts per million of fluoride. So it's one of the most concentrated fluoride products that we have in the U.S., but you're only going to apply a very, very small amount on the mouth of children. So actually the dosage that you provide is not as great as the concentration might dictate. The other thing that I'm putting here on the slide on the top portion is just to remind you that toothpaste in this country, over-the-counter toothpaste that have fluoride, which is the majority of toothpaste in the U.S., whether they are Elmo brand or Barbie brand, or whether they're meant for children or adults in the U.S., they all have the same concentration. Now, you can buy fluoride toothpaste without fluoride, and normally those are very clearly marked, and if parents are using one of those, they're normally looking for it, so they know very well if they're using a fluoride-free toothpaste. So before we begin talking about a little bit more details, here are some tips for handling 2-year-old children. And of course, you're all familiar with this because you all handle children normally. But in dentistry, because a lot of the things that we are doing on a day-to-day basis involve sharp instruments, we're very, very careful to offer additional measures to ensure the safety of the child and the safety of the provider and the safety of the parents who might be there in the room as well. So as you know, 2-year-old children like to say no. So I always remind parents that, the preferred position is a knee-to-knee exam, and we're going to show you some pictures to remind you of that. And that's just because that's an easy way for us to look at the teeth and apply the fluoride varnish all in one. But the moment you lay a child back of this age who cannot communicate very well, you're a stranger, they don't know very well how to tell you, I'm not too happy with this, I don't know you, the reaction is going to be, most of the time, to scream or cry. And this is not a cry or a scream out of pain. And so I always tell the parent ahead of time that there might be a little bit of noise in the room to reassure them that this is very normal. We're not inflicting any psychological damage on the child or certainly any bodily injury on the child. We're actually trying to prevent the child from getting hurt themselves. I also reassure the parent that nothing of what we're going to be doing will hurt. I ask for their help. The parents can be very important, or the caregiver, in helping hold the child's legs and arms so they're not kicking and moving and getting hurt. And also in keeping the child distracted. Depending on the child, I will ask the parent maybe to sing to the child or maybe to tell a story to the child so that the child's attention is on the parent and not necessarily on what we're doing, looking at their mouth. And of course, I try to engage the child a little bit before that to try to build some trust. And never ask them, do you want to lay down and do you want to open your mouth? Because, of course, the answer is going to be no. And with a smile, we just tell them we're going to count your teeth and this is going to be very cool and fun, and then we just proceed. The knee-to-knee exam is very helpful. Some children, as you might have experienced, are certainly a little bit more difficult than others and a little bit more apprehensive than others. So if you have a child that is very apprehensive and it's really obviously having a difficult time with the exam and the fluoride varnish application, there's no reason why you have to do it all in one setting. So you could do half of the mouth, let the child sit up and the parent have a hug. We call them a hug break. Let things calm down a little bit and then just go back for the second half. That seems to work really nicely for some children, where they just want to know that there's going to be an end to this and that things are going to be fine.
Dr. Fontana, I'd just like to say that a child crying is not such a bad thing, because when a child cries, they open their mouth very wide and the teeth are very visible at that moment. So getting a child, that's crying is not necessarily something that we can't deal with while placing the fluoride.
Right. That's very good, Martha. Thank you for the comment. And remember, these are not tears of pain or discomfort in any way. This is just the fact that we are laying them down on the lap of a stranger, and it's the way of the child of telling us that I'm too happy with that situation. So I have this next slide showing you two examples of knee-to-knee exams. The lower one was the toddler you saw in the Smiles for Life curriculum, because that was one of the images from that wonderful curriculum. The one on the top is showing an infant propped actually on a pillow covered with plastic on the provider's lap. But you can see that the principles are very similar. The parent is helping by straddling the legs around them and holding the child's arms so the child doesn't have the potential to injure themselves as the hands are moving, while the provider is controlling the head and then looking at the teeth. I have this little music symbols there to remind you that, again, I encourage parents to help and distract their child, whatever might work, sometimes singing to them, sometimes counting, etc. I also have an image of a puppet. We find sometimes, of course, this is a dental puppet. As you can tell, they have teeth and a toothbrush. But really, any toy that the child might bring themselves in the office might work, or toys that you might have there. It's just a way of distracting a child that might be very apprehensive. What we do is actually let the child hug the puppet and maybe count the teeth of the puppet as we are counting their teeth or looking at their teeth. And that seems to work also very well for some children. And the last image that I have on this slide is the little painter palette. Just to remind you that as you're applying fluoride varnish, the idea is not to be a Rembrandt or Picasso. This is not a perfect painting of the entire tooth surface. The varnish does work where you are applying it, and you need to make sure it's on the tooth, but you don't need to be microscopically covering every micrometer of the surface of that tooth. So fast movements on the surface of the tooth is really all that is required, and then you making sure that you actually got it on the tooth.
Absolutely.
So where to apply the fluoride varnish? As you saw the Smiles for Life curriculum, you probably saw the videos where they were applying it in a very organized fashion on every tooth surface. And that works very well if you have a very cooperative and tranquil child. But if you have someone who might be a little bit more distracted or a little bit more musical in their screaming because they might be more scared, really limiting it to the surfaces at risk would be beneficial. And the surfaces at risk for early childhood caries are the front of the upper teeth, so the upper incisors. I have the first image there with a blue arrow showing some anterior teeth with actually cavities. These are a much more advanced stage. And the biting surfaces of the posterior teeth, and that's the middle image that you see the other blue arrow pointing at. Again, those two images already have lesions that are holes in the teeth. So the reality is that we would like to, the varnish can be applied on the holes, but it's not going to be as effective as if you apply it on a smooth surface that is sound to begin with, or where you have the initial stages of decay. And the third image that I have on the slide on your right-hand side shows a primary canine. And I don't know if you can notice where the blue arrow is pointing. There is a little white line near the gum line. And that's the beginning of decay. Now, even if you didn't know, if you see a white or a brown spot at this age, assume that the most likely thing could be decay and apply the varnish right on top of it. The varnish can be very effective. And as well, please remember that the varnish is much easier to apply if you dry the surface a little bit with a gauze ahead of time. One of the most common questions that we get asked is, how do you help keep the child's mouth open or avoid biting? So to avoid biting, don't put your finger right in the middle of the dentition. The child might be scared, and actually the gloves might have a different taste or a different texture and feeling, and so their immediate reaction might be to close the mouth. So there's several ways of doing this. One of the most effective ways, the first image that you see on the upper right-hand side where there's a blue arrow and a glove coming into the mouth, if you move that glove finger into the posterior area of the mouth behind the teeth, in that retromolar area where there's no teeth, you can actually almost prop open the mouth, because by just having your finger there, it will cause a little bit of a gagging reflex, so whenever they're trying to close, they will open immediately without any discomfort. And if they don't have as many teeth as the toddler that you're seeing here, or the young child that you're seeing in the picture, when they bite on that, they're biting on gums, so it's really not hurting. You can always wrap your finger on a gauze if you want to, but it's really not necessary. So that tends to work really well. Another thing that tends to work really well is using something like a toothbrush. So I know at the beginning of your training, we provided you with samples of toothbrushes to provide your patients. Many of the toddler toothbrushes have soft handles. And one of the things that you can do if you are having providers in your clinic learn how to apply fluoride varnish, as you're handing that toothbrush to the parent, you ask them, you tell them, we're going to open it right now and we're going to use it, and then we're going to give it to you to take home. And just open it up, and with a soft handle, obviously not like the toddler in the picture where they're holding the brush themselves, but you can be holding the brush to prop open the mouth on one side, so they're biting on the handle. Let's say that you want to work on the left-hand side, the child would be biting on the handle on the right-hand side. And then you move it over to the other side. That works fairly well because the handle is fairly soft. Another thing that sometimes works in the lower picture, sometimes many of these toddlers will bring toys or teething rings, etc., that the parents have bought to help rub against the gums or the teeth, etc., and they're soft toys. And you can certainly use any of those things that the parent has brought that the child is already using in the mouth to help prop the mouth open. And I would always inform the parent first what I'm doing, so I'm not catching them off guard. But letting them know that if it's okay, I'm going to use this to help prop the child's mouth open so we can look and apply the varnish very quickly. And normally parents will be delighted to pull something out that they think would work really well for that. And another thing, for example, in the lower picture on your left-hand side, you can see the parent, in this case, the parent had brought like a little cloth that they were using to wipe the child's mouth and actually clean the child's teeth. And so we just asked permission if we could roll that cloth to use to prop the child's mouth open. So there's many different options. You just have to be a little bit creative, and many of these things will help. And you don't need a lot of time. Like I said, you're not trying to be Picasso, so you just have a little bit of time to quick glance at the teeth and apply the varnish as quickly as possible.
Margarita, let's just, for patients or for you guys out there who are doing this, getting bit by a child, I've been applying fluoride varnish for quite a long time on small children, and although I have been bitten by a child, I've never been bitten enough where it ever broke my glove or drew blood or had anything like that. Our teeth are sharp. They are made for cutting and chewing things, so they are sharp. But typically children are not going to bite you in a forceful manner because they're angry or because they're trying to protect themselves. So I think that using some of these techniques will definitely help eliminate any of the biting experiences that you all may have.
Yeah. Thank you, Martha. Very good point. And to finish up, I want to remind you that many of the varnishes that you will be using bring post-varnish instruction packages that are little sheets that you can tear up and hand one out to the parent, and I would certainly do that. For the most part, the post-care instructions are very similar. So the reason they're similar is because what we really want to do is to allow that varnish to stay in contact with the teeth for as long as possible. The varnish is going to peel off over time, but there's going to be a reaction between the fluoride being released for the varnish and the calcium in the tooth, and those calcium fluoride compounds are going to stay around for months and months at a time, reacting and helping to protect the tooth, which is why the varnish has a long-term efficacy, and you apply it, every 3, every 4 months, every 6 months, and you can still get a benefit. So you really want some time from the moment you apply the varnish until it gets peeled off. And so normally although the child can eat and drink right away, of course, things that are very, very hot will help dissolve the varnish. So you certainly would not want a child to be drinking something very hot, which normally kids do not in any case. And you certainly want to avoid something very crunchy because, again, it's going to peel off the varnish very, very quickly. At least right away. You also don't want to be brushing the child's teeth for several hours. The easiest way that I have found for parents to remember this is I tell them this is the only time that I am going to ask you to refrain from brushing, and I will just ask you to start brushing again your child's teeth next morning. That way I'm sure that they're not confused and that the varnish will stay in contact with the teeth as long as possible. And finally, we want to thank you very much for your attention on behalf of the partners that form the Michigan Caries Prevention Program. I can't thank you enough for the work that you're doing to improve the health of children in Michigan. We don't have access to these children. They come to see you much more often than they come to see us. So getting them started in healthy behaviors and doing what you're doing is of utmost importance. So with that, I thank you for your attention, and I'm hoping some questions have come in, so Martha and I can help answer them. Thank you.
Yes, we have had a few questions come in during the presentation, and just a reminder, if you do have a question, please type it into the questions box in your GoToWebinar interface. So the first question is, in regard to billing fluoride varnish, do you have to use the modifier 33 code for every claim?
This is Rachel. No, you do not have to use the modifier 33 to bill the varnish. You can use it. Many of our clinics actually bill it without and are being paid that way. But if you have if you get a rejection for some reason, you can try to rebill it with that modifier 33, and that should help with the rejection issue.
Can you recommend a specific fluoride varnish?
It's very hard for me to be able to recommend one brand because the reality is that the data that we have suggests that they're all probably equally effective clinically. We certainly don't have any data. We know that they behave differently in the laboratory, but we don't have any data to suggest that that translates into a clinical difference in efficacy. So my suggestion is if you have a brand of varnish that you have tried and you don't like the color, you don't like the stickiness, or you don't like the flavor, I suggest that sometimes you put it on your own teeth. Break one package and try yourself as a provider so that you get a sense of what it is like. Don't give up on it because most brands come in different flavors, and there's differences between different brands regarding stickiness or color. We gave you a couple of brands to try with that we thought and that we use here commonly in the school and our associated clinics. They range in color from a little bit more yellowish to a little bit more whitish, and with different levels of stickiness. I suggest that you try those, and if you have questions, please let us know. The questions all eventually trickle back to us, and we help through Rachel provide answers of those to you. But if you have particular questions, I can certainly give you more detailed feedback if there's a particular aspect in the varnish that you're looking for.
Okay. That is all the questions we have for now. If we have missed anyone's questions, we will email you directly with an answer shortly. Thank you, everyone, for attending, and have a great day.